Good afternoon. Welcome to the Commerce and Gaming Committee hearing. We have an action-packed schedule here today. We have a lot of items we're going to cover, and we're going to kind of move along through that. This will be second to the last time I will chair this committee. Aw, that's okay, because I didn't run this year, so they'll be finishing up my term in January, so I'll be having another hearing, I think, in December. And then after that, someone else will be chairing the committee. But it's really been a pleasure and an honor to serve in the legislature, but more particularly to work with the members of this committee. This has been a really fun committee and great staff. We've just had amazing staff. We've really done tremendous hard work for us and really dig down deep. It's a very complicated subject matter, and it's just really been enjoyable. So I'm moving on to some new pursuits, but once again, I really enjoyed this. But we're going to stay on top of these things until January, and that's why we're here today. So with that, we're going to start with paper products and legal and regulatory issues. Now, it's been some pretty big changes. We ran some bills on this, and of course now the federal government has stepped in and made some major changes. So we want to, Representative Kirby, welcome. We're going to go through some of these issues. So, Mary McHale. You have 10 minutes. We're going to keep a close eye on you today.
Okay, sounds good.
Thank you. Welcome to our committee. It's a pleasure to have you.
It's my pleasure to be here, and bear with me. I'm battling a summer cold, so I'm going to try to get through this without coughing all over everything.
Everyone will keep their distance after that warning.
Thank you. So thank you for the opportunity to be here to speak with you about the state and federal regulations recently put in place regarding e-cigarettes. The panels that are coming up behind me will give you an in-depth look into both the state and federal regulations. But before they come up, we thought it might be helpful for me to briefly explain how we got to this point and... Oh,
that's better.
Okay. Might be helpful for me to briefly explain how we got to this point and provide a framework for all the information that you're going to hear today. And before I get into the slides and talk about the federal deeming regulations, I want to briefly touch on 6328. ACSCAN supported 6328, which creates meaningful, thoughtful regulations regarding e-cigarettes in Washington state. It will bring statewide regulation and enforcement to a nearly unregulated market and will strengthen protections against the sale of these harmful products to kids. While 6328 addresses many aspects of regulation, ACSCAN was particularly proud to support a few main provisions. Firstly, it took steps to accurately define these products in state law. And by defining them in a way which encompasses the full variety of products on the market, we're ensuring these regulations will apply to the many and varied kinds of e-cigarettes currently available for purchase. 6328 establishes important youth access protections. By requiring these products to be in locked containers which require the assistance of a salesperson for purchase, we're helping to keep them out of the hands of kids. And lastly, this legislation establishes a vapor products retailer license fee and raised tobacco licensing fees and doubled the fines. And this was the first increase in the tobacco retailer licensing fee in 23 years and will go to pay for needed enforcement, prevention, and education. So you'll hear more about 6328 this afternoon, and now I'm going to get into the slides and give you a brief overview of the federal deeming regulations. So in 2009, Congress passed the Family Smoking Protection and Tobacco Control Act, which gave the FDA the authority to regulate tobacco products. Specifically, this legislation gave the FDA authority to regulate the following products listed on this slide: cigarettes, cigarette tobacco, smokeless tobacco, and roll-your-own tobacco. For all other products, however, the Tobacco Control Act gave the FDA the go-ahead to extend its authority to regulate products past the initial 4 groups you see listed here. And that's what these new deeming regulations have done. Provisions in the Food, Drug, and Cosmetic Act. Hang on, one second. On May 5th, the final regulations came down just about 2 years after the FDA issued its intent to create these deeming regulations. And it's worth noting that when we passed our state level regulations, we did not know that the FDA was going to be releasing their final regulations just a few short weeks later, as we've all been waiting a few years for this to happen. These final regulations extend the FDA's authority over the following products: cigars, e-cigarettes, hookah, snus, dissolvables, gels, and all future tobacco products. And where this is particularly relevant to the conversation today is obviously regarding e-cigarettes. Provisions in the Food, Drug, and Cosmetic Act that applied to new tobacco products under the FDA's definition now apply to all of these newly regulated products, including e-cigarettes. Any establishment that mixes e-liquids or modifies the aerosolizing apparatus in any way is now defined at the federal level as a tobacco product manufacturer. As such, these establishments will be required to do a few things: to register with the FDA and provide a product listing, Enforcement will be taken against misbranded or adulterated products, and they'll be required to provide a list of ingredients, including harmful or potentially harmful constituents, HPHCs. In addition, there are a few statutory requirements around these newly regulated tobacco products. Free samples of products containing nicotine will no longer be allowed. Claims of modified risk are no longer allowed, such as light or low tar that you may have seen on tobacco ads in the past. And all newly regulated products that have been put on the market after February 15th, 2007 will be subject to pre-market review and market authorization by the FDA. In addition to deeming, FDA is proposing 3 specific provisions be applied to newly deemed tobacco products, and they are prohibiting sales to minors under the age of 18, prohibiting vending machine sales except in adult-only facilities, and requiring a warning statement on products and advertisements. It's worth noting that state and local governments are free to create additional regulations around these products like we have done here in Washington. And there are a few things that weren't included, such as prohibition or restrictions on advertising and promotions, and the FDA did not touch a ban on characterizing flavors either. So the FDA has established a 75-day open comment period for the public to submit written comments about the proposed rule. In the proposed rule, FDA requests information, data, and research on many specific questions, as well as comments on the provisions mentioned earlier in the overall rule. Once the comment period closes, FDA will review all comments and develop the final rule.
When is the end of the comment period?
75 days from May 5th, so I'm trying to do math in my head really quick.
I'm not great at math in my head.
Yeah.
75 days from May 5th would be...
About August 8th.
Is that August 8th?
Is that the August 8th date? I was wondering whether that was the date of the beginning or the end of the...
I believe that's the end of the comment
Okay,
period.
great. Thank you.
Yeah. So with that, that's a quick overview. I'm happy to take any questions, but the panels that are coming up behind me are going to give you a lot of information and a lot more details. But I'm happy to answer any questions you might have about how the Cancer Society feels about this.
Perfect. Questions? That's a good overview. I appreciate that. And also being on time. Thank you very much.
Yep. Have a good day.
Thank you. Jason McGill, Francis Limtiaco, Justin Nordhorn, and Dave Horn. So, folks, some things have changed since we were on the subject in the last, 3 years, I think, talking about this subject. So
it's been an evolution, yeah.
It'll be interesting to see where everyone in government and in industry thinks where we're at, and what are some of the directions the legislature is going to need to be looking at as we proceed. Welcome.
Right. Thank you, Chair Hurst. Appreciate it. Members of the committee, Jason McGill with the Governor's Policy Office.
I want to thank you for your hard work, too, and the process behind the scenes of really rolling up your sleeves and trying really hard to kind of do a lot of shuttle diplomacy and work with a lot of folks in the last few years. I sometimes think the people behind the scenes don't get a lot of recognition, and you've done a very good job, and I want to thank you for the work you've done on behalf of your office. Of really kind of rolling up your sleeves on a very tough issue.
Thank you, Chair. I appreciate that, and to you as well, and members of the committee and your colleagues, both the House and Senate, bipartisan effort here with health and sort of business and retailer interests, and I think we have a good end product. You know, you're right. Over the last couple of years, I've tried to coordinate this effort with many sort of state agency interests and particularly health interests with sort of a single goal in mind from Governor Inslee, and that's just youth substance use prevention, especially from the sort of highly addictive drug that is nicotine. This is something we all can agree that is worthy, especially when confronted with sort of is sort of startling data about youth using these products at sort of amazing levels, and Francis and DOH will get into some of that a little bit later on here. So through the governor's sort of #1 priority, which he calls the healthiest next generation, really just a child health initiative, this came about in terms of working with stakeholders from across the state. And so over the last few years, once they prioritized this effort, we worked on a bill. We introduced that bill in 2015 with the Attorney General, and you'll hear from Dave Horn here in a bit, and really just to focus on, again, youth substance use prevention. Of course, this led to other, major issues in the bill and important elements such as child safety elements, labeling and child protective packaging, and consumer protection and licensing elements as well. So we're fortunate to have these good folks here to talk about the details of the bill and implementation, the status thereof, and I won't get into that. I'm thankful for Mary to highlight, and Dave can get into a little bit more detail about how this works with the FDA new rules. Really, I think very complementary, and we're very well positioned, probably leading the nation as in terms of other states' position to appropriately work on and regulate this issues to protect the public and particularly youth. But doing so in a reasonable fashion with interests from at the table from business and the retailers, and I'm glad to hear from them as well later on. So really a great team of agency interests and systems. I don't think we have Department of Revenue at the table, but the business licensing service is used here to streamline licensing for retailers to make it easier for them, and maybe Chief will talk a little bit about how LCB will implement that in its retailer fashion. This is a major undertaking operationally, especially in light of other major operational implementation going on. That's chiefly related to marijuana. I'm happy to report things are going well. There are, of course, few issues with implementation, as there always is. We've got maybe a slight delay with our patient medical marijuana database, maybe a week delay there, but very low impact to patients. They'll still be able to get their medical marijuana. I know not necessarily related to vapor products, but patients often use marijuana in a vapor fashion. So I, again, can't, on behalf of Governor Inslee, can't emphasize enough how professional these folks have been in getting this done right, especially with the other demands underway right now, especially from LCB, DOH, and then our great advice from the AG's office. We're fortunate to have Senior AG here, Dave Horn, who is just formerly Chief of Staff of the Attorney General's office, and heading up now our tobacco effort. So thanks, Dave, for doing that. So as you know, in wrapping up here, just a moment about this legislation. Chair Hurst, thank you for the highlight. This is not the exact same bill as you heard in committee in 2015. It's substantially similar, and the work you did in that hearing led to the further development, again, in a bicameral, bipartisan fashion with business and health at the table to negotiate these elements and come to a final agreement, which was, again, passed with very little contention at just the last session here. So again, let me assure you of that, and thank you again, particularly Chair Hurst, for your leadership on that, working with caucus and across the aisle and across the rotunda to really get this done in a sort of full picture interest of all at the table. And so with that, I think I'm turning it over, I think, to Chief for initial comments, or to Francis. Okay, go ahead.
So I will go ahead and advance the slides. Thank you, Jason. Thank you, Chair Hurst, and members of the committee. Thank you very much for having the Department of Health be a part of this panel. My name is Frances Limtiaco, and I am the Tobacco Prevention and Control Program Manager with the Washington State Department of Health. Now, as you heard, much of the provisions in this new state vapor product law has to do with licensing and regulating retailers. And you'll certainly hear a lot from the Liquor and Cannabis Board about what those are and how they're being implemented. But there are also some very important provisions in the state law that have to do with protecting the health of our youth. That's where the Department of Health comes in. Vapor products remain a public health issue, and I am delighted to share with you just what the Department of Health is doing in order to effectively implement the state law. So we know from the Healthy Youth Survey that cigarette smoking rates among Washington State youth have been steadily declining over these past several years. The unfortunate thing is that we are seeing vapor product use among 10th graders in Washington State to be dramatically rising. And what we're seeing now is that, in fact, between 2012 and 2014, the rate has actually quadrupled. I don't think this is news to you. We know now that the youth rate of using vapor products is more than twice the rate of youth using cigarettes. We're seeing that kids are both using cigarettes and vapor products. We also know that there are some kids who normally would have not smoked cigarettes, conventional cigarettes, are now vaping. And the reason why that's really important to us is because there is some recent research suggesting that kids who vape are at higher risk of smoking conventional cigarettes. Secretary Wiesman has indicated, and we certainly all support, that regardless of whether or not vapor products are a gateway to using conventional cigarettes, that we certainly want to see youth vaping in Washington State at zero, as well as smoking at zero. So let me talk a little bit about what vapor products contain. This might just be a brief review for all of you, but of course we know that nicotine is the most common active ingredient in vapor products. As Jason mentioned, it is highly addictive. We know from Surgeon General's reports that the younger you are, the easier it is to get addicted, as well as to quit smoking. The science is clear that there are negative effects on the heart, on the brain and lung development in young people. We know now that if you are a pregnant woman and are vaping, that there are potentially negative effects on the fetus, and that includes potentially preterm delivery, impaired lung function, as well as stillbirth. There are other chemicals in vapor products. We know that one of the main ingredients is solvents, and when heated, these become carcinogens. We know now that vapor is not just water vapor, but actually is an aerosol with various contaminants. Flavors can also be a problem. There's still many things we don't know. And until manufacturers are actually required to disclose the ingredients of what's in vapor products, and you'll be hearing that this is expected based on the new FDA deeming rule, that we really don't know all of the ingredients in many of these products. So DOH has several implementation rules, and I'm going to share with you just a couple of them. So we know that the bill provides that fines and fees go into the youth tobacco and vapor product prevention account. I have to get used to the new name. And most of the appropriations, and up to 70%, will really be distributed as grants to local communities so that they can identify those interventions that will work best to meet the unique needs of these communities. Now, these local community efforts will complement our state efforts and would be able to close the gap in terms of those areas that might be missed by a broader state approach. So what you see on the slide here are just some examples of the local interventions that we would like to support local communities in doing. I'd like to emphasize the role of public health in educating our communities. There's certainly a lot of work that still remains to be done in terms of educating communities about the known health effects of vapor products. And of course, the new state vapor product law has the provision that prohibits possession of vapor products by youth. We're already working with these local communities. They're already doing tobacco prevention and control work with some of the youth tobacco prevention account dollars. What we're doing is simply adding vapor products to their work. We do administer the Tobacco Prevention and Control Program, and as I mentioned, we're adding vapor products to that. Another very important function of the Department of Health in the implementation of the state vapor law is, of course, data collection and analysis. This is very important not only in helping the state and our local communities in identifying those important and appropriate interventions, but in seeing the effectiveness of the new vapor product law in mitigating or in reducing youth access to vapor products. So we certainly look forward to collecting and using the data. So DOH is also required or mandated to develop signage that would be used that will be displayed in retail establishments. We are working with the Liquor and Cannabis Board on the development of these signs. This is what the sign looks like. You've probably seen these signs already in tobacco retail establishments. The only difference is that, of course, we're adding vapor products. We also, the signs are also going to be distributed by the Liquor and Cannabis Board free of charge. So we're also collaborating with the Liquor and Cannabis Board on some additional educational materials for retailers. What you see on the screen here is a piece that we've developed collaboratively for store owners. What it does is it provides information about retailers' responsibilities in implementing the law. It provides some important health messages, and it also provides some information about why it's really important for retailers to comply with a new state law. We've also developed a similar postcard that's intended specifically for clerks. Both of these materials are intended to be translated into Spanish and Korean. We're also working with the Liquor and Cannabis Board on developing a updated training video that includes the vapor product law for clerks and retailers. I'd like to just emphasize that these products are not necessarily mandated to be done by the Department of Health, but we certainly want to work closely with the Liquor and Cannabis Board, and we agree that the best way to ensure compliance to the vapor product law is to do what we can to educate retailers and clerks. And we certainly want to do everything in our power to be able to support retailers and clerks be successful in complying with the law. So when the Department of Health started talking with the legislature on the prevention of vapor product use, our recommendation was to look at evidence-based approaches. The Center for Disease Control recommends a comprehensive program to address tobacco prevention and control in states and in the nation. And what a comprehensive approach is really a multi-component approach. It's a synergy of different elements that when implemented concurrently will yield the most effective and impactful results. So what you see on the screen are those elements of a comprehensive approach for tobacco prevention and control. And the reason why I'm sharing this with you is because this is what it is that we want to do with vapor products. This is what the research shows as evidence-based. We know that it works. This is what the legislature has supported in the past, and we look forward to continuing to work with the legislature and with you in order to continue to advance this approach. So as we thought about what are some future challenges, what immediately comes to mind, and we heard some of this from Mary, is marketing to youth. Advertising includes, and you see some images here, glamorous women, rugged men, even cartoon characters. And what this means is that the product is conveyed as sexy, as rebellious and cool. And this, you know that this type of advertising was very effective for decades with the tobacco industry until the Master Settlement Agreement essentially banned it. Because the Master Settlement Agreement does not pertain to vapor products, what we're seeing is the vapor industry is reviving some of these advertising techniques. Flavors is also another major attraction for youth. It is for this reason that flavors are banned under the Federal Tobacco Control Act of 2009 for cigarettes. Of course, we know the flavor ban does not apply to vapor products. We know, however, that historically these are the issues, these marketing strategies that have been aimed at youth that are a problem. We do want to work with the vapor industry as much as possible to help in this area. We welcome as much collaboration as possible so that it is clear that these products are not intended for youth consumption. So thank you very much for the opportunity for the Department of Health to provide this information. We're certainly open to any questions you might have.
Thank you, and thank you for the work that you're doing. Welcome.
Good afternoon, Chair Hurst and members of the committee. For the record, Justin Nordhorn, Chief of the Enforcement Division, Liquor and Cannabis Board. Just to walk through a little bit of the implementation for licensing and how enforcement is going to work, or how we're planning on it. So the licensing priority for us is going to be effective at the beginning of August, which is going to do a couple things. So we have some funding that was provided in this piece of legislation to provide officers for youth access enforcement around vapor. We're going to be setting up a standalone unit that does nothing but the youth access provisions for vapor, cigarettes, and the internet sale. Also a component of this for later implementation. And so that particular unit is going to be dedicated to doing those things, but some of the funding isn't going to be starting until October in that area. So what we're trying to do is make sure that we have licenses up and running by the beginning of August, so people have time to get the license, get the feel of what the regulations look like. We're sending out letters for educational purposes. We're working, as you heard, with the Department of Health to provide some educational materials. That way, when we start doing checks at these particular businesses in October, they'll have some time and experience within the regulatory industry, and they can ask those questions. I think if you were to start on day one, they're not going to know what to ask at that particular point. So the most effective way to do this is to get the licenses up and running, have people have some time to get some experience in that area, and then when we come in to do some educational visits initially, they'll be able to have those types of questions that we can answer and help them be successful in compliance. So that's kind of the timeline that we're looking at, is having the licenses starting to issue at the beginning of August, and then enforcement will begin more or less at the beginning of October. We've already started the educational components, as you've heard a little bit from the Department of Health. We've started working on a responsible ID video, how to check IDs effectively. We're incorporating all three products areas in, including alcohol, marijuana, as well as the tobacco and vapor. But it's going to be a short standalone video, about 8 minutes long. We're in the final stages of editing right now, so that'll be available very soon, where our officers walk through a store check, if you will, and describe what signs are required for these types of licenses, and then how to check an ID, how to responsibly look at it, what to do if you find a fake ID, what not to do, where you can ask questions, and those types of things. We've also launched a educational letter last week. We printed off over 6,000 letters and sent them out to tobacco retailers. We'll also be doing some hand deliveries of those standalone vape stores that they're estimated about 600 that we don't have necessarily the mailing addresses. So officers will be able to have that in their cars. When they see those, they can do a hand delivery of that letter to them to say, hey, this is what's coming. Please let's have compliance in this particular area. And so that started last week with the mailings. And so Department of Health is also going to be doing a follow-up that we're working with them on at the beginning to mid-July to be able to do a second mailing out so we can make sure that we're getting the word out in an effective and an efficient manner so people can be prepared for the regulated industry of vaping. Talked a little bit about the capacity issues that we're going to be shifting into the standalone vape unit. The tobacco violation notices, as you heard earlier in the discussion, the penalties are going to be increasing, so they're going to double in the amount, which I think from a policy standpoint was a good move, just based on the statistics that I think I've shared with you before. But our tobacco industry tends to have the lowest compliance rates across the board until you get to the third violation, because the penalties tend to be on the lower side. So it's going from first-time violation from 100 to 200. So it's not going to be a break-the-bank type of a progression, but I think it'll help with the deterrent factor as we move forward. That's actually effective today. June 28th is the effective date, and so we've been preparing, updating our forms to be able to handle that particular change in legislation, and so we're prepared to launch that and move forward with those effective implementations. The rules, there's pretty limited rulemaking for the Liquor and Cannabis Board in this particular statute. It's mostly encompassed all within the statute, but we did start a CR 101 on April 20th of this year to talk about implementation of this legislation. We believe that all of the rules are scheduled, if all the input and we don't have to do any supplemental rulemaking, should be implemented on September 21st of this year, so before we start doing the enforcement in October. So that's our timeline. We'll have just a couple areas of rulemaking essentially. We're going to be looking at clarifying some of the rules to make sure that we only have one license at each business instead of having multiple UBIs at a business. We want to see businesses be licensed, not residences be licensed for business, and that's been a concern in the past. So I think we're going to be doing some clarification around that. Of course, record keeping in the internet sales will have to be clarified on what we expect on that particular provision. And then for the non-nicotine tastings that may occur, it calls out they have to be an adult-only venue. And so unlike liquor, where we would consider that 21 and over, obviously this is a different endeavor because of the age restriction of 18. So we have to be clarifying what does that look like and what does that mean if you're an adult-only facility for the non-nicotine tasting products. We have put up some vapor product Q&As and frequently asked questions up on the Liquor and Cannabis Board website. And so we also see the increase in the licensing fees that are going to occur. And so that's something we've already prepared for. And we are having a combo type of a license. So we don't have people applying for multiple licenses if you have liquor, or I'm sorry, if you have tobacco, vapor, and OTP type of licensing. So we want to make sure that it's effective. People don't have to do 3 different types of applications, that they can have a combo type of a license. And then we're prepared to assist in developing the implementation, obviously, of the legislation, and we want to work really closely with the FDA deeming regulations as they move forward. Obviously, that's going to be in the best interest of the state to make sure that we're not going too far out of where the FDA is to put requirements on that aren't going to be in compliance with FDA rules and regulations when those become effective. But we also have, within my tobacco unit, or actually within the division, we have an FDA standalone unit. So I have inspectors that we contract with the FDA, and we do nothing but FDA compliance work. And so all of my FDA folks have just gone through deeming training, and they're prepared to take on whatever the FDA is prepared to move forward with. So with that, I'd be happy to answer any questions as we move forward.
Representative Kandata has a question.
Thank you, Mr. Chair. In the initial round of your checking minor sales, particularly in the marijuana stores, it was really good, and the numbers were really good. Now that we've expanded even further, is that trend continuing?
It is. So one of the strategies that we try to take a look at is modeling after the Office of Juvenile Justice and Delinquency Prevention, where their best practice is to check every business 3 times per year for a compliance check, which we don't do currently in alcohol. So we are doing that for the marijuana industry, and initially we were at about 88% compliance, and we're actually creeping over the 90 percentile range now on the marijuana area. So if we can model something similar, I don't know if we're going to be able to have enough resources at this point to do 3 a year at every one of the businesses, because we're looking at over 6,000 businesses across the state. But when we look at that model, it's very effective if we can have that out in front of them. People know we're going to be coming back. It's not a one-time thing. So, okay, we've passed this year. We don't have to worry about it. It's going to be there. And so it keeps people thinking about, how do I check an ID? What am I looking for? And keeping that in the front of the mind, I think, really helps with the compliance issues.
That's kind of where I was going, if it worked that well to use that model going forward. So great. Thank you.
Thank you. Welcome, sir. You have about 7 minutes to wrap up this panel.
Okay. Thank you, Chair Hurst, members of the committee. Dave Horn from the Attorney General's office. I'm going to talk a little bit about what the feds are doing with vapor products and how that affects what the state is doing with this very good bill that you passed, as well as to talk a little bit about state preemption of local governments. As Ms. McHale said, back in 2009, Congress told the FDA, you shall regulate cigarettes, cigarette tobacco, roll your own, and smokeless. And then later, if you want to, you can regulate all these other tobacco products, including cigars, hookah, pipe tobacco, and electronic cigarettes. And at the beginning of May, the FDA announced that, yes, indeed, they would regulate those products. And that's at least what I'm doing on this panel today, is to talk about that. The FDA rule, by and large, complements our new state law. Generally, they're regulating things that we don't. They repeat some of our law, but there's only a couple of areas where what the FDA did conflicts with our state law, and I just want to mention a couple of those. In the state law that passed, there is a provision allowing tastings of vapor products in adult-only facilities. Can't remove the product from the facility, have to use disposable mouthpieces, and if the product has any nicotine in it, the customer has to expressly consent to taste nicotine. Now the FDA has come along and banned all free samples of tobacco products, and a tasting in the eyes of the FDA is a sampling.
Now, didn't we default to preemption in the cases where there was a conflict in the legislation? So that's resolved by a federal standard in any event, correct?
If it's a yes. So, but the federal FDA doesn't cover all that we covered. Mm-hmm. So the FDA tobacco product is only things that contain tobacco or nicotine. Under state law, it's broader than that. It doesn't have to contain nicotine. So,
but in the case where there is a conflict from a legal point of view, where there is a conflict, I understand in areas where they don't address that we do.
the feds prevail, yes.
Exactly, because I think the provision was always in all of our proposals all along to do that.
Right.
Thank you.
And then, okay, so that was one of the two areas where there was a conflict. The other is labeling. And again, you built in something to deal with this potential conflict. In the state law, there's a requirement for labels on all liquid nicotine products. Got to include a warning about harmful effects of nicotine, about keeping it away from kids, warning that vaping is illegal for those underage, and then they're supposed to include the amount of nicotine on the label. The statute says that section expires when the FDA regs start to mandate federal warning labels. And that has been determined to be May 10th of 2018. We believe that's the date that their warning label requirements will actually kick in and become enforceable. And so the state requirement will be in effect until then.
On that point, our intent never was to force manufacturers to have 50 different labels for 50 different states. The industry made a compelling argument of, how can we be in a business if it's a legal and legitimate business, and, you can't cross state lines with a product because of improper labeling. So our intent always was to default to that. But with the federal standards, how do those compare? How do those line up with what we had in our legislation? Are they more restrictive? Are they more simple? How would you describe them in a nutshell?
Well, they're different, and they're murky as yet because they haven't really developed all of what they're going to talk about. For example, they don't. There's nothing in the rule yet that says that they have to talk about the level of nicotine content. And yet the FDA has told me that when they get down to pre-market review of labels and products, that's something they're keenly interested in.
On a case-by-case basis, or as a broad policy on all products?
Well,
have they really told you? I'm asking you to guess a little bit here, I guess.
Yeah,
I know you don't like this as an attorney,
they will. No, it's all right. I suspect they will develop some kind of a policy on it. But in general, it'll be warning labels.
Okay.
So I think the philosophy is similar to what we did here. And then, of course, as you've heard, they banned modified risk claims. Probably the biggest difference and the biggest change from what's in the FDA rule is that the FDA is requiring manufacturers to register and then to submit their products for pre-market review, which is a very thorough process with the FDA. And that will have an effect on. There are a lot of standalone vape shops now in Washington where people are mixing their own in the back room. It's probably going to put a crimp in that unless those folks are, are able to submit their products for review.
Well, I think that'll put most of those out of business that don't fall into compliance for pre-market testing.
It may have that effect.
Now, that would be a submission not to our testing facilities, but to the federal government testing facilities, correct?
Yes, sir. That's purely an FDA process. The other thing I should mention is that the pre-market review has a grandfather clause in it, and this is back to the FDA rule. Anything that was already on the market by February 15th, 2007 is grandfathered in. As soon as the FDA released this rule, the U.S. House Appropriations Committee passed a rider to their budget proposing to move the grandfather date up to August of 2016, which if it passed would essentially say if you hurry up and get your product on the market before August 8th of 2016, it's never going to have to get reviewed.
I'd be very surprised to see that happen.
I would too. But anyway, we have weighed in against that. Attorney General Ferguson wrote a letter and said he didn't think that made much sense.
Good.
And state preemption of locals, I drew the short straw on this, and so I get to talk about it for a minute and a half that's left. In general, in the state law, local jurisdictions may regulate indoor use, except that they can't ban the tastings that we talked about earlier. And the general rule for outdoor use is that local jurisdictions cannot regulate outdoor use except in places where children congregate. And the bill says such as schools, playgrounds, and parks. And so local jurisdictions who are interested will be trying to identify places in their counties and towns where kids congregate and perhaps ban or regulate the use of vapor products in those places. And in closing, I just want to say we appreciate passage of the bill. It's a strong bill. It's not perfect. We think it gives us a good head start on protecting the public health, especially the public health of kids. And I have heard from people in other parts of the country who appreciate what the legislature has done on this issue and are looking for ways to do something similar in their states. And I'd be happy to answer any questions.
Thank you for your work and your office's work on this as well. So a very important subject. I realize it was kind of murky, but to actually get out ahead of it a little bit, I don't think the intent ever was to have this be a mom and pop, start mixing this stuff in a bucket in the back room. I think there was a strong argument made by some of the industry folks that they were going to be it was going to be easier for them to comply on a national basis, on a national standard, everything from testing to packaging to marketing, although they brought in some very fair arguments, which was a state-by-state adjudication was never in anyone's interest. It was going to be impossible to handle the products. We had common carrier issues, all types of things. So as this settles out, this is potentially a very dangerous product for people to use. I mean, we have to recognize that, like all substances, it's a free country. People can make their own decisions, but this is not for kids, number one. And number two, you have to have informed consumers. And I think this is one of those products where if those federal rules make it so, once again, people mixing this in the back room who are not going to get tested, we're not allowing that with marijuana. We're not allowing that with alcohol. So, you know, we have some pretty strict standards on things that could be harmful to people. Not that we're going to babysit everyone in the country, because we're not. It's up to a person whether they want to smoke cigarettes or vape or gamble or anything else. That's what this committee is all about. We want to make sure that they are safe. And I appreciate the work of getting out ahead of this and making sure that, once again, primary objective is to keep this out of the hands of kids and not poison consumers with a product that's not properly tested. And I'm completely convinced that on a national basis that the industry can handle whatever demand is there in a responsible fashion in conjunction with these rules. So thank you. Representative Kadada.
Thank you, Mr. Chair. Would I assume then there might be some need for additional legislation to bring these things into line? And can we expect some agency requests from all or some of you to do that, or is this something we need to work on to make sure that the two are compliant?
A variety of people in a variety of agencies are making lists, and so
Okay.
some or all of us might be back. We're gonna, we're working on the bill as it is for now, and seeing
sure.
how it develops.
Okay, thanks.
Thank you very much.
Thank you.
Good job. Thanks for the presentations. With that, we'll have industry panel. Jeff Stier, Kim Thompson, and Mark Jarrett. What, no Emily Murphy today? Oh, she's here. Welcome, folks.
Thank you.
Pleased to have you here today.
Thank you. I'm Kim Thompson. I'm from the 27th District. I am the president of the Pink Lung Brigade, a Washington State Business Association that represents the vape businesses and the consumers here in Washington. I also own the Vaporium, which is a chain of retail shops that were born and raised right here in Washington State. In order for us to really understand where we're at right now, I think it's important to know where we all came from in this industry. And I want to take us back really quick on just a quick trip through history and start us out at 2007, which is where you heard the FDA and some of the counties here locally would like to take our industry back to. Back in 2007, it was the birth date of the electronic cigarette onto the American market. It lacked efficiency, it was hard to get, and it was cost prohibitive. It was filled with e-liquid made in China because there weren't any e-liquid manufacturers in the U.S. So you can see if we go back to 2007, we're going back to basically a product that didn't help people quit smoking and that had an e-liquid in it that nobody could test because it was made in China. So moving through 2007 to 2010, there's this very little growth in innovation in the market. About 2011 is when I decided that I needed support, and I wanted to support support others. I had started vaping back in 2007 on that electronic cigarette, and realized that there needed to be a place to help people to make the conversion to this safer product. In 2011, I opened my doors, and I was very surprised to see, for such a young market, that my customer base that was coming in that were either just quitting vaping or quitting smoking or had just begun vaping were already building their own electronic cigarettes. It's called they were modifying everyday items like a flashlight, Altoid cans, Nintendo game controllers, remote controls. They were already in 2011 mixing at home, consumers mixing e-liquid at home at the kitchen table. So, you know, we're going to move forward again to 2011, just a few months after realizing this. We went down to Tacoma Pierce County Health Department and started sharing our concerns in wanting to protect the public and move our industry forward in a regulatory pattern with the help of our state to do exactly what we're all here to do today, is protect the children and also protect adult smokers who are looking for a safer alternative. You know, it wasn't long before those people that were mixing at home for their own consumption also realized that there was a burgeoning industry, and they began making e-liquid, and licensed businesses had grown from there. So we now are in 2016. We have an amazing vape bill that we all worked so hard to put together, and I'm really proud of that robust system that we've created here. It's very forward-thinking throughout the nation. But we are still at a great amount of risk in returning back to the kitchen table and to the days of building mods. If our products are reversed back to 2007, people will go right back to the wild, wild west. You won't have businesses that want to work with the state. So one of the things that's very concerning to my community is the local jurisdictions interference with the goings-on inside of an adult-only vape shop that are besides what is already covered by the LCB, which is 17 pages of very wonderful regulations that we're all looking forward to complying with. When the county starts to come into the adult vape shop and limit the amount of customers that I can service to 3 and not allow me to offer them a chair or a drink of water, I think that is showing that we really need to have a little bit more, this needs to be a state-wide uniformity, and allowing counties to basically run rogue inside of an adult-only vape shop, I believe is not good for our community, and it will put our vape shops out of business.
Thank you. You know, I'd like to also back up in time, and I think that's a good historical perspective. I appreciate that. But I'll also back up in time and say that several years ago, a couple of years ago, I sat down with everybody at the table and said, I wasn't a big believer in local preemption on this. I think we needed a statewide policy. I think we need a national policy, and that the local preemption issues were going to become very problematic, because you could actually, and I think people should be able to use the product they want to use, and if someone wants to use this as opposed to smoking and it gets them off cigarettes, I don't know that this is 100% safe. It's probably not, but I think there's probably ample evidence to prove that it might be better than smoking, and I say might, because I'm not a scientist or a doctor. But fundamentally, I really did oppose the concept, and I told folks in the industry and a lot of your folks, I said, the counties will crush you county by county by county, and they'll put in very draconian. We were much better off to actually have adopted a bill. But it was folks from your industry that said, no, 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 you don't have the votes to do it. Why should we do that? And I mean, that was problematic, because we had negotiations a couple of years ago, and I sat in hours and hours and hours and hours and hours of meetings saying we need to, and I was more than willing to do preemption. And it was folks in the industry that kind of torpedoed those efforts, and that's how we got to where we are today. So I will also turn back the clock and shine the light on some realities, which were there were people that were unwilling to negotiate a couple of years ago, when I was more than willing to say we will deal with this issue of preemption. And I realized there was a battle between the mom and pop shops and the local folks and the national folks. They had different interests. I think they all could have been accommodated. So part of what got us to where we are today, and whether there's a return on investment, had a little bit to do with a couple of years ago people being unwilling to sit down and bargain in good faith at the table. So I will defend this institution, and having gone to great lengths, both sides of the aisle. This wasn't a Democrat or Republican thing. I think people really, truly wanted to get this figured out, but there were so many entities that couldn't get along, that couldn't function together, that has led us to the path we are today. We didn't deal with preemption because folks said, well, I didn't get every little thing I wanted, therefore I'm opposing the bill. And that's where we were a couple of years ago. So I appreciate your perspective, and I agree with it. I think it's right, but I wanted to add one little point and illuminate that there were options that would have resolved the issue of preemption once and for all. And I was one of the advocates of that on your side. I wasn't going to agree with every little single thing that each entity in the industry wanted. That's part of what compromise is. You know, no matter how perfect or right you are, compromise is still better in the end. So just as a little bit of a side note on that, but I appreciate your perspective. Yeah, thank you. Welcome, sir.
Thank you. Good afternoon, Chair Hurst, Ranking Member Carrie Condata. My name is Mark Jarrett. I'm Vice President of the Pink Lung Brigade and co-owner of Bonsai Vapors, which is an e-liquid manufacturing facility located in Lakewood, Washington. I'd very much like to congratulate this committee and all of the legislature for passing Senate Bill 6328. It's definitely a great achievement. It's been called by the National Conference of State Legislatures one of the most comprehensive legislative efforts to date. Kim has already expressed to you our community's concerns with the local jurisdictions. I would like to just say in response to some of the talks that we were having a couple of years ago is that some of the negotiations and some of the things that were being discussed at the time kind of scared our industry. 95% taxes, 60% taxes, things that would have really wiped out our businesses. And so I think once the governor's office and the attorney general and everybody was willing to focus on the policy issues and the youth prevention, best business practices, those sorts of things, and not necessarily focus on the tax issue, is when we were able to really come to the table and really have a really open discussion about like what we are for in conjunction with you and what we can do to kind of get this thing passed. So just kind of my little addition there, but thank you. I would like to personally focus on the FDA's rules and how they will negatively impact small e-liquid manufacturers like myself and subsequently the vape shops that we supply. My partners and I actually we were one of those makers that was at the kitchen table mixing e-liquid back in 2011. And very simply, e-liquid is comprised of about 3 to 4 ingredients. I generally, when I hear some of the industry professionals say like, well, we don't know what's in e-liquid and we're so curious. It's like, well, we've been putting ingredient listings on the label since 2011, 2012. So it's very simply comprised of about 3 to 4 ingredients. Most of it's commonly found. You can find it at Walgreens, Michael's, or through the internet. And 3 of those 4 ingredients that are in e-liquid, vegetable glycerin, propylene glycol, and food flavorings, are not age-restricted products, right? So you can mix zero nicotine e-liquid just by going to a Walgreens or a Michael's. So in 2012 is when we got our business license and started Bonsai Vapors. And because of the positive business environment in Washington and the local support that nourished our growth, you know, we have a homegrown company now that is now globally recognized and sold internationally. And I, like many of the small business owners we represent, have actually dedicated my entire life to this industry, including being here today and speaking with you fine gentlemen. And you know, it was all because of a struggle to quit smoking, you know, and vaping helped to save my life. I truly believe that. And, you know, we believe that we're helping smokers eliminate most of the harmful chemicals, improving their quality of life and that of those around them. And while we can't really rid ourselves completely of all of our vices, we can at least show that this particular vice can reduce harm by about 95 to 99%, according to the Public Health of England. So with Senate Bill 6328, we've again led the nation and appropriately created separate chapter for vapor products, which recognizes that vapor and smoke are different and should be regulated separately. But currently, all that hard work that we worked for is under threat as a result of the FDA's recent ruling, now deeming vapor products as tobacco products. And what that's going to do is knock Washington State and our country back about 9 years in technological advancements and solid legislative work. If we don't challenge these regulations, and at least the nuances, because we're not saying we don't want to be regulated. I think we've proven that we want to come to the table. We want to prevent youth access. We don't want vending machines. We're vehemently against that. We want to see these products regulated that gives access to adults, prevents youth access, and continues good business practices so that everybody can kind of choose what vice they want to partake of, as you have said yourself, Chair Hurst. But what this will do, these FDA regulations, it will pave the way. If they're not challenged, it's going to eliminate 99% of the businesses on the market. I'll explain how here in just a second. It's going to pave the way for a small number of big industry, tobacco manufacturers, Chinese manufacturers, and Wall Street-backed entities, or what we'd like to call the 1% of our industry, to be the only players on the market. It's going to destroy small businesses, extinguish American jobs, and kill the innovation which has led to the growth and improved quality and safety standards of our vapor products. By the FDA's lowest guesstimate, the pre-market authorization, which was discussed, I believe, by the Attorney General's office before, will cost hardware and e-liquid manufacturers like myself in excess of $1 million per product. So each little bottle or that we produce of e-liquid, or each device that is produced on the market, that lengthy pre-market authorization process is going to cost about $1 million per product, and my company alone makes about 60 products. So if you do the math on that, it's about 60 million plus. So even clearly, even smaller e-liquid companies that produce 3 e-liquids won't be able to afford the $3 million plus price tag that goes along with that. And so what our industry is actually facing is a fiscal prohibition on our products, as opposed to just outright banning them. And this is for a product that only contains 4 ingredients, all of which are available over the counter or through the internet. So I don't think that this is going to eliminate any vices or stop people from actually trying to get their hands on vapor products or find alternatives to smoking. My fear is that it's going to create a black market of individuals that will begin experimenting with making their vapor products in their homes, and many of these consumers are not going to take the safety precautions that we have taken to kind of move ourselves from the kitchen table into professional establishments and taking safety precautions, and they're going to be modifying battery-operated devices and handling high concentrations of nicotine. And worst of all, it will cause many former smokers to turn back to combustible products and continue a deadly habit. We will see all of our progress and hard work helping and converting smokers go to waste, and additionally, we will increase the risk of health and harm in our communities and to the children therein. So we do have a small window of opportunity to save this industry from complete annihilation at the hands of the FDA's deeming rules. It was brought up before, the Cole-Bishop Amendment, which will basically say that all of the existing vapor products that are on the market up until August of 2016 will remain on the market without the pre-market authorization process. And we are asking this committee and legislature to share these concerns with our United States congressional lawmakers and ask them to support the Cole-Bishop Amendment, as well as House Representative Bill 2058, which essentially does the same thing. Thank you so much for your time today. It was an honor to speak in front of the committee, and on behalf of a community whose shared engagement with state government has actually proven to be effective. This very issue has united legislators with us and has inspired and activated an entirely new base of voters who are now more politically aware, civic-minded, and eager to participate in the government process, as I am one of those people. So thank you very much.
Thank you for your excellent presentation. Well spoken. I will go back one more time just to the negotiations.
Sure.
I'm the person that actually suggested a significantly lower tax rate and even potentially no tax for a period of time. One of the compromise things we discussed was a 30% rate to resolve this permanently, in hopes that for the industry's sake you wouldn't come back at a rate that pushed it into the black market. So here's part of my fear. If you tax something too high, you don't stop it from happening. You just stop the legal portions of it from happening. We're having the same problem with cigarettes. We're talking about lowering the tax rate on marijuana. Why? Not because we want more people to smoke marijuana. We want to make sure that people are not smoking products from the illicit market. So we have this issue. We're talking about alcohol. today. We know that we're having cross-border sales with the state of Oregon, but when people go down and bring back truckloads of alcohol, we no longer control the delivery of the product. So once again, taxation has always been a problem. And you had a legitimate concern at 95%. I agree with you 100%. I was a big believer in that was the wrong path to take. But once again, I have to defend this process a little bit and say that as part of that, I felt, and a lot of other folks felt too, that a permanent resolution of a tax rate was better than a pending unknown tax rate, and that was rejected. It was, once again, I think there was a problem with negotiations. As we come to this issue of the testing of products, sir, I just have to disagree with you. These are products that people are going to ingest into their bodies, and I don't care whether it's eggs or this or any other product, marijuana. If people are going to ingest a product, it has to be tested. And if I think the idea that this will destroy American jobs and people won't have the product is not true. I just disagree, and here's why. An industry that can't submit products for testing, that can't be an excuse for taking away American jobs. It's a shift of American jobs to companies that can. Now, if you're saying it's unfair that larger businesses will take over portions of that market, I get that, and I understand that, but that's what the free market is. People that can compete in the free market are people that have the resources, not just a dream and an idea, but also a legitimate plan that will go out and make it work. 9 out of 10 small businesses don't survive their first year. Not because they didn't have a good idea, it's because they didn't have a good business plan. So the concept that if we don't support your proposals, we're somehow hurting businesses, it's not true. These products are going to be made, they're going to be distributed. People that want these products are going to get them. Now, there's a host of companies out there that have the resources to submit and compete with those on a testing level, but it was never the job of the legislature to be a referee between different entities in business. That's not how the free market works. So I once again, I will say that, at least in my opinion as chair of the committee, if this is a product people are going to ingest, we need to know what's in it, and we need to know that it's safe, and it does need to be submitted for testing. I don't know whether it costs $1 million. Maybe it does. But if that's the cost to ensure that consumers are not being poisoned because there was something wrong in that theory, in that process, but I'm sure that there are plenty of companies that will be able to meet that standard. If there's a demand for a multi-billion-dollar industry, a $1 million price tag will not slow that down. Our marijuana industry, which is an interesting parallel, we have people that started in that business and saying, hey, wait a minute, I'm kind of getting drummed out of business by regulation here. But the market's being met. It's $1.3 billion a year. People are able to comply to testing, and what we've seen is not an increase in price. We've actually seen the price of that product go down and down and down. Now we're looking at trying to actually get it a little lower to get rid of the last of the black market, and that makes sense. And the arguments that you folks have made about too high a taxation, absolutely correct. I agree that taxation shouldn't be the driving factor. We shouldn't be looking at these kind of products or other types of controlled substances as free money to come in. It should be about public safety, and there is where we share the greatest amount of agreement, I think, in this. But I do have to say that I do not believe that because a company can't compete and can't get testing done, that the product won't be made and won't be available. I'm fairly confident that it will be by companies that have the resources and the business plan to implement that. But once again, I thank you for your testimony. It's both of you very well spoken, and I very much enjoy you having here today. I just wanted to say a couple things. Representative Kirby.
Thank you.
Thank you. I believe that the bill, as originally introduced, was designed to put you all out of business.
It was, yeah.
It was really a phony way to ban your product by just regulating you into oblivion. And you can ask Jason McGill, who came to my office one day, and my hair was on fire about this because I am a big, I'm a big believer in not limiting access to products from adults for any darn thing they want to do that I can think of. It's not part of my public persona this time of year, but you should know that I vote against seatbelt laws and I vote against helmet laws, and I'm kind of I've got this libertarian streak. So I went kind of crazy nuts, and we spent a good deal of time Yeah, these guys wonder why I'm on this, sitting over here.
We're all like this on this committee.
And so, you know, there was like pages of intent language that was full of baloney, in my opinion, that didn't need to be in the law, you know, the taxation, everything, the bill was just designed to put you out of business. And so I got together with the caucus, my caucus staff, and started to do it on my own because I couldn't get anybody that day. And I wanted to fix it that day. And so, you know, she came in and we wrote a bill. And it was real similar to what, you know, was eventually introduced in the committee here. I have this slight disagreement with my good friend, the chairman, in that I'm sitting here trying to figure out how can you survive? What can we do to help you survive in this new environment in which the federal government has spoken? Can you help me with that?
Yeah, I can, and it's what would be beneficial is if the free market could determine what is good and what isn't. Our products have been tested. We've sent them off to labs for testing. The testing costs us thousands of dollars, not $1 million. And I just think that particular bar is too high, and it is, again, like I said, fiscal prohibition, as opposed to you're just pricing everybody at the market, and then you allow the largest firms, which I get as part of the free market, to kind of decide what people get, the quality of the devices, so on and so forth. And in the market that we have today, we've got such rapid growth and innovation, and it's happening so much faster than legislation can actually keep up with it. And I get that that's scary, but it's also led to some tremendous improvements in the quality of our devices, the safety standards, so on and so forth. And if we're looking at an e-liquid that, 3 of the 4 components in the e-liquid, besides the nicotine, are generally recognized as safe, and we haven't had like a mass rash of poisonings or like people getting sick from e-liquid or vaping. And I could very much see if that was an epidemic of things that were actually happening and the vapor industry was seen as it being some sort of systemic cover-up, then yeah, I would understand why the bar would need to be so high. But, there are many things that we consume as both adults and even some children, in terms of like energy drinks and things of that nature that actually have been proven to kill people, that actually have a record of actually harming children. And we don't have a bar that high for energy drinks. And I wonder why e-liquid if there's no rash of poisonings or people becoming hurt. And what we've seen is what I believe, and I'm probably, to my detriment saying, a pretty successful migration of former smokers adopting this new technology. Why is the bar for vapor products so high? And so what we can do is we can encourage our congressional lawmakers to support the Cole-Bishop Amendment. We can encourage them to co-sponsor on 2058 and at least allow the market freeze to occur at a time that recognizes when vapor products actually came on the market. They're tying vapor products to tobacco, and they made this decision about tobacco retroactive to 2007 in 2009. There weren't any vapor products on the market at that particular time. Give the market a time to review the products that are on there. I'm fine with the freeze at this point in time if that's what the FDA feels it needs to do to stop new products from coming out on the market, but don't destroy small businesses before you actually have adequate proof that it is actually causing a harm. And that is most of what we're fighting against, when we talk about these things, is that wait, you don't really know. We believe it's 95 to 99% safer, and so do a lot of people. Let's find out for sure.
So what we can do is talk to our colleagues at the federal government.
Absolutely.
It's not a real, when it takes an act of Congress to fix something, Ooh, that's a tough one.
Sure, sure, yeah, no, and we have some support, in the Senate. Senator Johnson has called the FDA and asked for them to, provide some reasoning as to why they've, produced such draconian rules and, how it's going to be supported and how it's going to be enforced. And they have yet to respond to him, as from what I understand, they have yet to respond. And, we do have, bipartisan support in the Cole-Bishop amendment. That's, the rider attached to the appropriations bill. So there are some people that see this for what we see it as, which is, again, fiscal prohibition and allowing the market to be in the hands of the small few. I don't think it's any coincidence the fact that big pharmacy and people that push nicotine gum and nicotine patches are the ones that are really pushing for these FDA rules, and that the head of the FDA was a former consultant for one of these pharmaceutical companies. So that's just my particular perspective. It's not an allegation, but nonetheless.
I think what Representative Kirby is saying is the federal delegation doesn't really pay very much attention to us, but
Yeah.
as a general rule. We do have to wrap up. If you can be brief and with your comments. And
I'm Jeff
it's been a good
Stier.
little discussion today, folks. I really enjoy it.
I'm Jeff Stier. I'm a senior fellow at the National Center for Public Policy Research, and I appreciate the seat on the table together with industry, but I'm not industry. I represent consumers and a free market approach, so I can be quick today because I think you all get it. You understand how markets work and how that markets are better at solving problems than the government is. And when you look at public health, and I represent public health, these people sitting next to me are the true public health heroes because they are helping people happily quit smoking, something that the government has been unable to do. With all the taxes, all the regulation, all the warning labels, they haven't accomplished what my colleagues here have been able to accomplish, happily quitting smoking and dramatically reducing their risk. And when you think about public health, they're not taking a taxpayer penny. They're actually giving back to the community, and they're voluntarily, in their own interest, helping people quit smoking. And I think that's what's so fantastic about it. I've testified about this issue from the United Nations down to the FDA, the White House at Office of Management and Budget, state capitals around the country, and local governments. And I'm so happy to be here before your committee because your committee, your law, has gotten it right more than almost any other state has. So it's a pleasure for me to be, while you're still here, Chairman, to be before your committee. It means a lot to me, and I know that you get it. I wanted to make, however, a couple points, perhaps nuances that you might want to consider as you look at this. And it's not actually coming from me, but it's actually coming from Mitch Zeller, the head of the FDA's tobacco division, where he talked about, yes, the importance, I think everyone's on the same page, about keeping these products out of the hands of kids. We're all on the same page. Making sure that industry doesn't accidentally poison anybody. We're all on the same page. Mm-hmm. A third element to appropriate regulation of these products, as Mitch Zeller has explained, is the idea, the concept of tobacco harm reduction. And I appreciate the libertarian bent. I share it. But from a public health perspective, Public Health England has said these products are at least 95% less harmful than smoking. The Royal College of Physicians in England has just come out and recommended that doctors advocate that their patients, recommend that their patients use these products instead of smoking because they're so much less harmful. So what Mitch Zeller from the FDA has been saying, in addition to these regulations, is that not only should we make sure that the regulations are fair and allow these products on the market, but to thread the needle with the regulation to make sure that while we don't let kids get their hands on these products and don't poison anybody, we also don't limit access to adult smokers. And I was concerned with all the good things that I heard from the Department of Public Health here, the talk about flavors. Flavors are critical in e-cigarettes to make sure that adult smokers who quit stay off of cigarettes, because adults find those sweet flavors so appealing that they quit smoking and they use these products instead. And if anyone did anything against flavors, people would go back to smoking, because adult smokers, adult former smokers, love flavors so much that it got them to quit smoking. They learned that they actually don't like the flavor of burned tobacco. They actually like the sweet flavors, and that keeps them off of smoking. So flavors are critical. And with regard to some of the numbers we've seen that the health department presented on vapor use by young people, I just want to caution that while everyone agrees that youth shouldn't use these products, the chart that was available, it was on page 3, showed a very steep increase in youth vapor use, there should be no use of vapor use. But it also coincided, very interestingly, with a recent decline in youth smoking rates. I wonder why that is. And while there should be no use of any vapor products by any youth whatsoever, that sharp increase, did you ever read the book, How to Lie with Statistics? It used a graph like this, where it zooms in on some number to make it look huge. And there's no excuse there shouldn't be any. But this graphic is an example like that was in that book, because it shows an increase in a short period of time. And actually, the backdrop is a decrease in smoking rates, and you can reach your own decisions about why that is. But I just want to congratulate this committee and the state for an excellent job. I've seen it play out in different states around the country, in the federal government as well as internationally. And I think you guys have done what Mitch Zeller from the FDA has asked for, is to get that appropriate balance between making sure kids don't use their product and no one gets poisoned, but also protecting the idea of tobacco harm reduction for adult smokers to quit. Because not only should they have a choice, but it's something that I think regulations should be set up to encourage people to quit smoking. That's good for public health, especially if they do so voluntarily, which is why I appreciate your approach on taxation, that if you're going to tax these products, if you're going to have a sin tax, and I don't like the idea of sin taxes either, but if you're going to have a sin tax, then the rate of the tax ought to be in line with the degree of the sin. And e-cigarettes are a dramatically less bad sin than smoking. So we have to keep that in mind. And with regard to the FDA, to the Cole-Bishop Amendment, this federal rule, I agree with you. If we're going to ingest these products, we ought to test them. I think everybody agrees to that. But what the FDA actual regulation does is it sets such a high standard at $1 million per SKU number, per each and every product. So if you have 60, that's going to put Mark out of business because it's $60 million, not just $1 million. And there is a way to test these products, and I'm an advocate for the free market that should be appropriately regulated. The deeming regulation, which goes back to this 2007 grandfather date. Imagine this. Imagine an iPhone, which came out around the same time. Could you imagine and I think those products should be tested, right? We have to make sure that iPhones are safe. Could you imagine if the federal government came out with, the FCC came out with a rule that said all iPhones today have to be the same as the first generation? That would drive people crazy. You can only use the first generation iPhone, or each new app on your iPhone has to go through $1 million testing. That's absurd. And iPhones don't save the lives of people the way e-cigarettes do. So the FDA rule, as is in place now, and by the way, they can ban flavors. They have the deeming regulations are what Mitch Zeller describes as a framework, an architecture for future regulation, depending on how the science comes in. So they can do that. But what they're doing now, by going back to 2007, it is going to put the small businesses out of business and is going to raise the cost. It's going to be basically a regulatory tax on smokers who want to switch, because it's going to raise the cost of the product so much. There's got to be a better way to do it, and the one way to do it is the Cole-Bishop Amendment, at least for now, stops the death knell of innovation. Right now, innovation is over. No one's investing in this industry anymore for innovation to make these products safer, less appealing to children, and yes, more attractive to adult smokers. Nobody's innovating because innovation ends on August 8th or already. So thank you again for having me. I'm happy to answer any questions if there are any, but I'm so happy to see that you all seem to get it.
We need to move along. We have some other issues we need to cover today. So I want to thank you for your testimony. Do you have a pressing question?
A quick one.
A very quick question and a quick answer.
Thank you, Mr. Chair. Well, yeah, great testimony. Thanks to all of you. Certainly a new pathway, just like marijuana and everything else we're learning. Just one thing, and this bifurcation of nicotine versus non-nicotine products, do you see that being an enforcement issue in your stores? I mean, is this going to create two levels of product enforcement because you have some nicotine-related products and some that are not?
Well, in my stores in particular, we have all of our samples available in zero nicotine. We only would give nicotine if it was requested by the customer. I don't see that there would be a problem. We keep the bottle of the test of what we have tested because we fill up with it, so we have the product right there and available. The potential cost of testing, I'm not really too sure of yet. Who has to pay for the testing of the sample and what kind of testing that would be.
Okay.
If it'd be a $1,000 test like Mark has been done on his product, or if it'd be $1 million test that the FDA would like, I'm not sure.
Thank you. Thank you for your testimony. Thanks for the panel for coming up. Really enjoyed it today, all the folks that have testified. With that, we're going to move on to preventing access to liquor, marijuana, nicotine products on the part of minors. Priscilla. We're getting a little behind on our schedule today, but welcome.
Thank you.
No. He'll be back. He'll be back.
We live in the same community, so. My name is Priscilla Lisicich. I'm the president of the Washington State Association for Substance Abuse and Violence Prevention. Thank you for asking us to testify today, Representative Hurst. We appreciate it. We are an organization that works to educate people about the harms, particularly to youth, around alcohol and marijuana and violence. We collaborate with a lot of other organizations, and including law enforcement and other advocacy organizations and treatment entities. Due to the challenges presented to our communities through the approval of initiatives 1183 and I-502, we are particularly concerned about youth access to alcohol and marijuana products. We are also advocates for ensuring that the purchase of tobacco be set at the age of 21, as well as restrictions on the sale of vape products to persons under the age of 21. To start, I'd like to acknowledge the progress we made this last session with Senate Bill 5052 and the Cannabis Patient Protection Act. Many of us are relieved in our local communities. As of this Friday, many of those little green crosses have disappeared now from our communities, and that we believe that that has been really important in helping to reduce youth access in particular, which there are hundreds of anecdotal stories about young people being able to get medical marijuana cards and easy access to marijuana. Data from the Substance Abuse and Mental Health Services Administration shows that we are most at risk for abusing or experimenting with substances between the ages of 12 and 20 years. So our drug use escalates during that time, or our experimentation. These are developmental years when youth take more risks, and it is during this time that we need to ensure we have sufficient protections to reduce exposure to harm. 80% of youth in our state who enter inpatient substance abuse treatment do so for marijuana. Additionally, WASAP, our organization, did focus groups in 2013, and we found out that youth use vape products to smoke highly concentrated butane hash oil, which is quite dangerous. The most recent 2014 Healthy Youth Survey showed a decrease in the perception of harm. So young people around the use of marijuana, young people are still feeling that it's okay, it's legal now. Those little green crosses probably did contribute to that. We're going to be very interested in seeing the 2016 data that will come out. Are we going to continue to see a decrease in the perception of harm? Because of course we want to increase the perception of harm. 45% of 12th grade students reported no or low risk from regular marijuana use, and 66% of 12th graders reported easy access to marijuana. For 2013-14 school year, 42% of the statewide suspensions are related to marijuana, and 48% of expulsions are related to marijuana. We believe this is particularly exacerbated through unregulated advertising, as well as insufficient funds for prevention programs as promised in Initiative 502. As early as 2014, studies were published showing that early age, 12 to 13 years old, use of marijuana negatively affects the development of the adolescent brain. And the Department of Health representative testified earlier about early onset, early use really does create an addictive lifestyle. In 2007, a study published in the Archives of Internal Medicine documented the fact that marijuana smokers report serious symptoms of chronic bronchitis, and other respiratory illnesses. Again, children who are developing 12, 13, 14 years old, their internal organs are still developing. So the brain is impacted, our internal organs are impacted. Also in 2010, another study showed that marijuana use during adolescence is directly linked to the onset of major mental illness, including psychosis, schizophrenia, depression, and anxiety. Now our communities are experiencing unregulated massive advertising. Open up the paper on Sunday morning, it's just covered with ads to come and buy marijuana. And the thing that is really disturbing is when you read the ads, there are some entities that show the harmful effects in print that you can actually read. But many of them, the print is so small, I'd have to get a magnifying glass in order to read it. So we are submitting our concerns to the Liquor Cannabis Board, which is now collecting information about advertising, but we believe that maybe the legislature needs to take a good look at this too.
Is there a font size requirement?
Not at this point that I understand.
LCB shaking their heads no. So,
No,
and they were actually shaking their heads yes when you were saying there was a problem.
Yeah.
So maybe one of the issues that needs to be addressed. I've actually seen some of these same ads, and I share your concerns. Some of them are very upfront in their warnings, and actually to be commended. And other ones, I don't think a magnifying glass would have worked for me because they were so small. It's like those radio ads where they say things so fast I don't even know what they're saying.
Right.
So clearly the intent of having a warning is irrelevant if the warning's not clear.
Right.
I think it needs to be in clear language, but it also has to be easy to read. And I think some of the folks are responsibly doing that. Some of them clearly are not. I've seen the same thing, and this is something that should be a priority to address.
Right. And in fact, we've discussed the fact that the wine industry, when you look at labels on wine bottles, we would recommend taking a look at that because that's good font size, it's clear, it's, you know, and it can fit on a wine bottle.
Those are excellent. And you look at those, and if you had any, you're not going to miss those warnings, and you're going to realize that a person that's pregnant should not be using the product. At least it's going to cause a high level of guilt, and probably in a lot of cases, maybe for a person to think about it.
Yes.
So I want the same thing. I really think that this issue, not just a font size, but also clarity of message. So those need to be clear, and it's too bad the industry is not doing that on their own, but clearly some are not. I saw some of those warnings, and I didn't even know it was writing. I thought it was maybe some kind of a graphic or something.
Hieroglyphics
at the bottom, but in
Yeah,
fact that turned out, because I couldn't see the warning, and I thought, wow, how can they advertise without a warning? But then once again, I actually have a jeweler's loop you can look at.
You do?
and got that out, and you can say, wait a minute, that's actually the warning. Well, it's silly if you have to put a jeweler's loop on to read it, so it's kind of defeating the intent of the law. Good point.
So we have, I've provided you with packets that have some backup material in it, and one of those pieces has been the most recent HIDA report. It was just mainly the executive summary, but you certainly could look at that. They call out the high-intensity drug traffic area about the legalization of marijuana, kind of where we are right now. Besides the healthy use survey data, they call out extraction lab explosions with THC 17 explosions occurred in 2014, so we need to be looking at that. Particularly because the extraction processes, typically using highly flammable butane gas, can be ignited just from static electricity, your clothing, or even from refrigerator cycling. So that's an area that we need to take a look at. You mentioned we still have a thriving black market, so we need to be looking at how do we limit access through the black market. And also incidences of marijuana impaired driving are increasing. Drivers with active THC in their blood who were in a fatal driving accident rose 122% from 2010, which numbered 16, to 2014, which numbered 23. And that was according to the Washington State Traffic Safety Commission. The Washington State Patrol toxicologist reports that rates of driving under the influence of marijuana, including among youth, have significantly increased since legalization. Another disturbing statistic is phone calls to the Washington Poison Center, and this is particularly related to edibles. And if you've ever seen one of those little gummy bears that is for sale as edibles on the market, you're a parent, you put your gummy bear down. The ear of a gummy bear is a single serving. So this is another area that we have a real concern around. We'd like to look at legislation that would identify sale of a product as a single serving, not like a full gummy bear that might be 5 or 6 servings. And what happens many times is somebody will eat that ear thinking, okay, that's a single serving, and then they're waiting and nothing happens. And then, so they try another ear. And then they might try a hand or something of the gummy bear. Well, eventually the high starts to kick in, and now they've gone too far. So, and then if you think about the availability of that to children, it's really disturbing. So the marijuana-infused product reports by the Poison Center increased 312% over the last 3 years, and calls related to marijuana oil jumped 350% over the same period. And these were for children and adults who were reporting concerns about being poisoned. Legal marijuana production is balanced fairly equally across the state. Of course, there are more outlets in Western Washington than Eastern Washington. We believe prevention is the key to long-term health and educational success of our youth. By strategically investing in prevention programming to the fullest extent possible, we can reduce the age of initiation in marijuana use and alcohol use. The research of the University of Washington Social Development Research Group shows if we're able to reduce the age of initiation, we help youth to develop habits that will guide them toward healthy choices in their lives. Even if they experiment, their early core learning establishes a set of guiding principles that speaks to health, staying away from the risks of illegal activity, and supports them to complete their high school education, seek post-secondary education, and technical training. However, it looks like we're failing this test for prevention, and I did include in the packet an article from the Columbian, and there's also a citation about the Seattle Times article, and there's a chart in there about how we believe the prevention initiative has been shortchanged on the revenue side when you look at marijuana revenue and what was actually allocated. In 2016, prevention, treatment, education, and research we were promised $42.8 million. We received $20.9. Money went to the general fund. The general fund was slated to get 30.4 and got 51.7. Same trend for 2017, what's planned, and then for 2018. So the prevention programs in particular that are being targeted are very specific around the state, and there are 85 sites around the state, and then of course through the Department of Health with the accountable communities of health. There are 9 districts. What we think is missing here is the evidence-based program of community mobilization. Again, the Department of Health folks talked earlier about the opportunity to connect with local coalitions. Well, community mobilization provided that broad-based community coalition across each county that helped to bring communities together, to bring the community voice to the table to make healthy, positive change. That was successfully funded from 1989 to 2012. We'd like to suggest that you take a good look at this funding pattern and reallocate funds back into prevention, and that you include community mobilization in that. In 2013, there's also a citation here from the Washington Institute for Public Policy. They studied the Communities That Care model, which community mobilization follows. It is a coalition-based community prevention program that aims to prevent youth problem behaviors, including underage drinking, tobacco use, violence, delinquency, school dropout, and substance abuse. We work through a broad base of community organizations. The benefit to cost ratio in their study was found to be $3.61. So we'd like to take a moment to really help emphasize the fact that by creating a small investment of $1.8 million for the biennium across the state to reinstitute community mobilization, we believe that we can contribute to building and sustaining healthy communities. We understand the challenge of funding K through 12. However, prevention education and community mobilization works hand in hand by supporting healthy youth development. And I've written more here, but I know I'm almost up at my 20 minutes, so. We do evidence-based programs. We get the community to help define what is needed in that local community. So in effect, Representative Kirby, it's a little bit of a libertarian example where local communities get to define what is really going to work for them, because they know the best, I think, at the grassroots level, rather than us laying a model on top of them. So fully funding prevention as promised in I-502. That could include vapor product education that was suggested earlier. Regulating our advertising. Don't make marijuana look like medicine. There's an example in here of a billboard that says, medical marijuana doctor. I mean,
is that a strip club or a medical marijuana store? Because it looks like a combination of both, actually. It's a remarkable, and that's a billboard in California.
Yeah.
I saw that.
But there's also, there's billboards like this around the state, including, there was an advertisement in the paper on Mother's Day, you could buy your mom a bud and help her have a good time. And actually, it's illegal for me to buy something and gift it to somebody else, for me to buy a bud and gift it. So it's like really promoting illegal. So we need to look at advertising really closely. There are big billboards in many parts of the state, and we're starting to do our photos and sending those to the Liquor Cannabis Board so they can have a closer look at that.
This is a good point, and actually the LCB has come up and said that it just drives them nuts to have to deal with those, and we have a lot of jurisdictions that want to have much more strict regulations on a local basis. I think part of the answer to this would be to turn a lot of this signage issue over to locals, take it away from the LCB. I think the LCB, they told me at one point in time what percentage of their complaints were over that, when they really want to be doing enforcement on, undercover operations where juveniles go in, et cetera, and regulating this traceability system and all the other stuff. And we have, at the same time, local jurisdictions that are complaining about, we don't like the signage, it's too much, we want our, and this comes back to your concept, which is what are the local standards. I think if we could turn a lot of this signage away from the state back to local jurisdictions, it would free up resources, and also it'd give you an opportunity to, on a community by community basis, because I think you'd see some much more restrictive signage and advertising. So that's a model that I think would be very, very beneficial, and probably would be a lot tougher than the model you have today. And it would be enforceable.
And being able to really support that local community engagement, which I think is what we're saying around the prevention
thank you very much for your,
and then also really looking at the servings of marijuana, really looking at that, because I think it's having a lot of negative effects, particularly with small children, and then people who can't seem to regulate themselves, saying, that, well, maybe I should wait 30, 45 minutes, an hour before I feel that high kicking in.
Thank you, and thank you for your presentation today. We actually got to move on. We have another half an hour to go yet, so.
Yeah, you missed all the hot action here.
Representative Kandata has a brief question.
Yeah, I sense a little conflict in your testimony, and I was just at a similar meeting in Wenatchee the other day on this issue. And when you say that 50-52 helped because it took a more unregulated industry and made it more regulated, but on the other hand, you don't like evidently 502 or illegal marijuana. Which side is it? Because the legalization process is an attempt to get it out of the black market, get it out of kids' hands, and they're obviously, compliance-wise, doing a really good job of not selling to minors. So we seem to be moving down that correct path, but there's a conflict in, then you think because it's legal, it appears to be more, it's okay, and that there's more people going to accept it or something. So which one is it?
Well, I think one, the resolution of the unregulated medical industry, I think that, for me, I know in the community that I come from, we called it the Green Mile. You go down Pacific Avenue and there are just green crosses everywhere. That unregulated environment, along with youth access through those entities, really helped proliferate the idea that it was okay. So I don't think that there is a conflict. We are concerned that we need to make sure that we're regulating the recreational stores, which LCB is doing a great job with that. You walk into a store, I mean, I visited some, you walk in, there's a security guard. Children are not allowed inside. I mean, they can't just run around. So the idea about making sure that it's seen as an adult activity, an adult environment, is what is really important. So in the advertising, on the advertising front, I do think that there is a danger if we're not really helping to establish strong, if you will, regulations, policy that helps local policymakers to drive good public policy locally, as Representative Hurst has suggested. So it could be one or both ways, something from the state, or it could be encouraging the local communities. But the point is that we don't want to market this to have you think that it's okay, that it's a medicine. I mean, there are medicines, but usually they don't have the high THC content, the whole formula.
Thank you.
Does that answer your question?
Thank you.
More or less, we'll continue the discussion.
I'm happy to have us talk with you more about it.
We can continue the dialogue, yeah, thank you.
Okay.
With that, we're going to move on to David Trujillo, Brian Considine, Chris Stearns, and Julia Patterson, if she's here. Didn't see her, though. Have her name on the list. Group 12 Amusement Games. And the Washington State Gambling Commission, folks, it's always a pleasure to have you here. Welcome back to our committee. Welcome, Chair Stearns.
Thank you, Mr. Chair.
Thank you, Mr. Chair.
And Brian Considine, Managing Attorney, Legislative Liaison for the Gambling Commission.
Yes. Committee members, I know that we're short on time, so
We're fine. We can go over.
Okay.
There's nothing after us today.
Okay, good. Generally, for the most part, our intent here today is to provide you with an introduction to the latest iteration of the amusement games to hit our great state, what they look like, how they work, how they came into being, and what has happened since the rules were authorizing them were passed in July of last year. To my far left is Commission Chair Christopher Stearns. He'll say a few brief opening comments, and then we will turn the bulk of the presentation over to Brian to my left, and he will share with you all the good, engaging stuff that we brought for you today. Chair Stearns.
Outstanding.
Thank you, Dave. Mr. Chairman, thank you, and thank you, committee members. I just wanted to thank the Chairman Hurst for all the leadership you've done over the years and for your work on this committee. Really appreciate that.
Thank you. I appreciate that.
Just to echo Dave, this is a matter that the commissioners have spent a lot of time on, and we're really trying to make sure that we get back to our original intent and to keep things in Washington where they're supposed to be. So with that, I'll pass it on to Brian, and he'll explain exactly how we're doing that.
Thank you, and thank you for your good work as chairman of the Gambling Commission.
Thank you, Mr. Chair, members of the committee. So, know most of our commissioners. Chair Stearns is our chair for about another 4 days, and then Bud Sizemore will be our chair starting July 1st, with Commissioner Patterson being vice chair. So a while back, well before I was around, many decades ago it seems, the legislature decided, hey, we have these amusement games, they're a fairly unregulated entity, and we're going to sit them inside the regulatory control of the Gambling Commission. There were several enacting statutes, 946 being the main one, authorizing the Gambling Commission to have regulatory control over amusement games, and then defined amusement games in the slide. I won't belabor reading it for you, but basically dealing with a material degree of skill, which is a unique flip of normally a material degree of chance, which is what you normally deal with most other gambling activities. So really the basic facts, when amusement games came around, we created a rule, WAC 23013, that specifically deals with amusement games. Really until just recently, amusement games were things that you generally saw in family fun centers, Chuck E. Cheese, carnival games, the fair, and pretty much a lot of different places, but not necessarily as technologically advanced as kind of what we're dealing with right now, though it is changing, which we'll get to a slide. And really, the introduction of games was fairly basic. Under our rules, it was basically, hey, provide us a description, let us know what the rules are, tell us what group you think they should go into, and up until before July 2015, we had 11 groups that had very broad categories. And then there was a 60-day waiting period before the person or the entity could put the game out into play, barring us saying, I'm sure, that it was something that didn't fit into the category or that it wasn't a proper amusement game. And so examples of games are, your kind of basic skee ball, Pop-A-Shot, the various different carnival games. But also, as I'm learning with small kids, there's many different fun centers that these things are populating in, starting with, I think, things that were a little bit bigger, more, I would say, called clunkier kind of machines, but also taking what really were phone apps, I think Candy Crush and Fruit Ninja being them, and kind of turning them into amusement games that would spit out tickets. And then came along the Group 12 amusement games, and these are visuals of the three different types of manufacturers that we currently have in the state. Generally tabletop sort of games, and I'm going to demo one for you here in a minute, but also things stand up, and we don't really have regulations as far as what they have to be encased in. We've been more focused on the actual software. But before we show you the demo, I think it's always nice to have some comparisons. I know in the discussions, at least since November, since I've been around, there's been lots of discussion dealing with Georgia and Ohio. Georgia has about, I think, a little over 22,000 machines in about 5,000 locations, but they're in a very different kind of regulatory environment. One, I think Georgia only has the lottery until these machines, which were always kind of operating in a gray market, came under, I think, the control of the Georgia lottery, though enforcement may be under their similar type AG's office or something like that. Mostly located in convenience stores, I think, along kind of with the lottery system. No cash prizes, merchandise only, expressly prohibits gift cards, gift certificates. Similar play style than what we're finding in Washington. I know some of the manufacturers that are bringing games into Washington also have them in Georgia. But also strong, now that they have more regulatory control over them in Georgia, strong regulatory control as far as once they go outside the scope of what the rules were supposed to do, such as giving away cash, things like that. Lots of anecdotal stories from Georgia as far as seizure and prosecution. Ohio, I believe, is the same issue where it was kind of in a gray market. They legalized gambling, I want to say, in 2009. And so now they're in the process of dealing with a very kind of broad set of rules, but now the Ohio Gaming or Casino Control Commission is looking at providing more rules to try and better regulate it. But their statute, and I think both of them are statutes that deal with merchandise prizes, no cash equivalents, no gift cards, and it's expressly prohibited in statute. So if this will work, figure I will give you a quick demo as best as we can. Our gaming lab did a great job, and then I can go through the timeline as to kind of where we started from with this, and then
see if it works.
So, sorry, I'm going to back up. It went a little quicker than I thought. So the way this is one set of games. There's manufacturers a couple different sets of games. Normally you're going to have a screen. You don't have to put in any money in order to select a game and start kind of browsing around. And so there's nothing on the game. You can pick which game you want to play, and then it loads. Sorry. This is proving to be.
Looks like you got to let it run.
Yep. So what you will see is you're going to pick the game. There's a prize viewer that he's pointing to. You can go up in the wager amount. I think it's normally every credit equals a cent. And then what you can do is view the prizes to see what your potential winner is going to be. So there, right then, they knew the next game was going to be 100 credits that you would win, or 100 tokens, electronic tokens. So you put in your money, you load your credits on, and then you preview, yep, you're still going to win, and then you play. And this is called a nudge game. And so basically, you pick which one. You have to match 3 in a row on this game, and lower, you get your 100 credits. So you pick a different wager amount, or you can pick the same wager amount. You press the prize viewer, which is whether or not you're going to win. That showed that you're going to win 50. You play. There is a timer in the bottom left, shows, and then you do actually have to push it. So if you push the wrong way, then you're going to lose, and you're not going to get your credits. Yeah. Same thing, shows that you're not going to win, but you can still play. And you still have the ability to raise and lower, though, even though you're not going to be a winner on that one. And then you exit. You're ready to kind of tick it out, and then you can take your kind of electronic tokens with your electronic credits. It's printed out. And then I'm sure different businesses, different models, but generally the idea is then you would take that to a front person or to the bartender or whoever, and they'd figure out kind of how you're going to work with those credits or those electronic tokens. So that is a quick demo of one of the games. There's a couple different types of games that are out there. There's one that's similar to more of a tic-tac-toe. There's another one that's, there's more reels, and it's a little bit more complicated as far as kind of how you're going to do it. This was the most simplistic version to try and show the committee. So how did it all start? Well, it started beginning of 2015. There was a petition that was submitted to the commission asking for basically a new group of amusement games for adults. Petition process, I like to give the analogy, is kind of similar to what I think is the initiative process, in the sense that it's not really coming from internally within the agency or within the government regulatory body. It's coming from the outside, somebody who has an idea that they want to try and have the commission essentially vote on. So it comes to the commission. The commissioners took a look at it, I believe, in April, and the commission looked at it, I believe, in April, and then at the April, May, and July meetings, it was discussed in an open public meeting. I believe there was examples, machines brought in so the commissioners could take a look at it. And at the beginning said yes, filed the rule, I believe, probably in May. We normally don't have June commission meetings, so that's why there'd be a gap. The stakeholders and commission staff worked on really basic rules, as you would expect to add a new group. And then in July 2015, those rules were presented to the commissioners, and the commissioners passed it, I believe, unanimously. And this was the basic new group. So it's group 12 because that's the next number after 11, and we already had 11. And basically this was the really foundational elements for what Group 12 games should be as far as electronic puzzle and pattern, and it's modeled very similarly as 1 through 11 to be broader so that you have a group in which you can fit things into a broader group. And the difference with this one, unlike some of the other games where it's location specific based on kids or not kids, this really specifically only prohibited them being anywhere really for places under 20 or under 21, so it's 21 and over. So September come around, the rules become effective August 10th. The first set of games approved by the commission are September 23rd. Now, this is still under the rules where basically there's not testing. We submitted it, we had them in the lab, and staff basically looked at it, played with it, and made sure that it followed the really basic rules as we expected. There were at least one game that I know of that we felt was too simplistic, and that one was rejected, but the rest were allowed to move forward. And so what is visualized on the screen is, as you would expect businesses to do and being entrepreneurial, they started without kind of structure, started rolling things out and rolling things out quick. I know the businesses, especially small businesses, taverns, other places that generally have pull tabs, were very excited about this new kind of innovation and really thought it would be something that could help out their business. On the left is a merchandise prize board. Having going to Costco a lot, I think it may be from Costco, but basically different prizes that you get for your credits or tokens. On the right was what we started to run into, which was try our video slots, cash payouts out to $2,500. And when we started looking into this, as we started hearing about this, we were finding out that there was cash payments or gift cards that were being given out, or gift certificates that were being given out, but really what was happening is you'd get a $50 gift certificate or gift card for the location, you'd buy 50 cents of something and you get $49.50 back in cash. So it was a pretty quick workaround to the cash. So this came up, I want to say in probably October, November. It was specifically addressed at the November 2015 commission meeting with all 5 commissioners opining on it and expressly letting know the industry that this was not their intention when they passed the rules, that when they thought merchandise prizes, they really thought hard merchandise, some sort of physical thing, modeling after the fun centers when you have all your little trinkets. And that they requested staff essentially initiate rulemaking, work with the stakeholders, and start trying to come up with some sideboards as to dealing with some of the issues that were coming up, and to maybe have a little bit better control over these amusement games. But as we were getting into this, maybe there was a better way to start trying to better define certain things within the amusement game world.
You know, Brian, I think this speaks to intent. And so the Gambling Commission had what they thought they were approving, which they believed was brought to them in good faith. And why wouldn't you assume that somebody brings you something in good faith? But if you simply look at those last couple slides and then what happened so quickly, this didn't happen by accident. This was carefully planned out. This was a scam from day one, an absolute scam. I'm going to call it what it is. That was the intent of what these were designed for. They were never intended to be games of skill. I think that what they presented to the Gambling Commission was completely untrue. And the truth of this deception by folks in this industry was proven by what they very quickly did with it. This isn't something that somebody sat around for several years and thought, my gosh, can we use it in this way? These were going to be operated as slot machines from day one. And the fact that they were already advertising those, try out our video slot machines. I mean, you know, actually writing that there, this was part of what they were intended to be. And if you look at the experience in other states, you know, who thought, once again, backed their way into this, not understanding what the intent of this industry was. And this has been reinforced time and time and time and time again. I think with some of the statements that were made, the threats that were made to the commissioners of what would happen if they, you know, tried to roll this back to what their intent was, simply to clarify their intent. So the Gambling Commission says we're going to clarify our intent, and what happens is these 2 letters that come from the industry, just outright threats, you know, saying what's going to happen. In other words, if you don't do what we want, if you don't give us what we want, what we always plan to do, we're going to sue you. And then some of the statements that were made about simply burning up the Gambling Commission's budget, that they couldn't win the battle. I think this, as you move forward in the presentation, I want to be very clear in my mind that I think that the Gambling Commission operated in good faith. I know some things were said about staff. I have every confidence in staff that they're trying to do everything they can within the boundaries of what the legislature sets and the commission sets. I think we have great people working there. I think they want to do a good job. They're trying to vet, they're trying to inform. But essentially, we have commissioners who also were doing their very best to do something they thought was the next logical step, Group 12, because it was the next number, and it didn't, and it seemed fairly innocuous. But if you look at how this was implemented and how quickly that happened, and then the things that are being said even today by some of these folks about, well, you know, we'll get so many of these things in here that there won't be enough gambling agents out there to enforce the law. I mean, this thing has been a scam since day one. I continue to believe that. I've been kind of vocal about that. But this is an intent to introduce, through a back channel, slot machines. Now, if we're going to have slot machines in this state, we may. We may have slot machines at every gas station someday, but that is a public policy decision that the citizens want to be a part of, and they have now twice said we don't want a huge expansion of slot machines. I think that is a legislative issue, not an issue for the Gambling Commission. I think the Gambling Commission is correct in the regulation of amusement games. That's entirely proper. And when have we had this kind of a problem? When you had a claw that picked up a toy and you either got it or you didn't, you know, those are pretty simple. They've been around a long time. They don't produce a lot of revenue, but why the amount of money and lawsuits and all that stuff if this is simply an innocuous thing? And the other thing I want to point to at this juncture, aside from the slides that you just showed us, is the statements of the industry folks themselves. They keep making horrible personal accusations against people in the Gambling Commission, legislators, other people in the gambling industry who are legitimate members. And in one hand, they say, well, we're not gambling in any manner, shape, or form. We have nothing to do with that. But they criticize the tribes and say, hey, they're trying to keep us out of the gambling business. You can't have it both ways. You can't say that you have nothing to do whatsoever with gambling, that you're entirely a game of skill, and then accuse the tribal interests of being opposed to ceding some of their market share in gambling. Call it what it is. And I think that these continue to reinforce the letters that I've written to people, the statements that I've taken. I think we are really looking at an industry that, if they intend to operate outside of the rules, are nothing more than organized crime, plain and simple. If you say, we're not going to obey the laws, you don't have jurisdiction over us, and we're going to engage in an illegal activity because we don't think you have enough agents to do something about it, now you're engaging in essentially organized crime. But I just wanted to point out is how quickly this happened, and I think these slides were very important, which was $2,500 cash prizes on a machine that they swore was nothing more than a game of skill, but they called them slot machines and had these huge cash payouts. This was a huge diversion from what they were represented to be and how they're actually being used. And I think we're going to continue to have this problem and fight this battle. Once again, if we're going to do this, maybe we will. Maybe the state of Washington, maybe the citizens in the legislature want to have slot machines in every restaurant, every gas station. But that is a public policy decision that does not fall under the purview of what Group 12 games were. And I'm not criticizing the Gambling Commission. I think that what they did was proper. I think that once again, this was a bit of a scam, and they were not fully informed as to what these things were going to do. Representative Condado.
Thank you, Mr. Chair. What is the range of bets on these machines? What's the lowest you can bet, and what's the highest you can bet, and what is the range of prizes? In other words, what's the ratios? Is there truly a $2,500 payout on these things? I mean, it was in merchandise.
There was no cash for a while.
Certainly,
I get that.
And so the restriction on it, there wasn't, Dave can correct me if I'm wrong, there wasn't as stark of a restriction on it before the commission started to engage in rulemaking. So it was something that was possible.
So you could put a $100 bet on one of these things?
You could, I think with some of the way the machines were working, you could put anywhere up to probably a few cents to, I think it was up to 500. Now, the new rules, which I'm going to speak to in a minute, try to put some sideboards both on the amount that you can wager, for lack of a better term, and
that's the proper term.
Well, to me, the interesting thing is the amusement game, though it is something that is not a gambling activity. I think just because it was easy for everybody to just use gambling terminology, uses and integrates a lot of gambling terminology into amusement games well before Group 12 ever came into play.
Mm-hmm.
So
I would agree.
And as far as prizes go, I think there was some inarticulate kind of talking about the prize is what you could win, the winning amount of the, say, credits, which has been defined, which has been capped, versus the merchandise prize, which we're not talking about, because that's the general sense, right? You know, in the Kid Fun Center, if you wanted to collect 1 million tickets and get the remote control car, go for it. That's a lot of money that your parents are probably allowing you to spend, but go for it. And it's similar with here, which is not really concerned about the amount of prizes that you would redeem those for, but putting a cap on the amount that you could wager and the amount in which you could win at any given time as far as those electronic tokens.
Okay, well, listen to what you have to say there.
I wanted to add that. I mean, one of the things we wanted to make sure was that what you buy in, your credits, are really different than what you get out, your points. I mean, there really should not be a correlation, because if there is, then it's like, yeah, then it makes it easy to say, yeah, I'm wagering. But that's we want to keep those things separate.
And that's similar to way groups 1 through 11 work as well.
Yeah, I was just at a Buster and Dave's for the first time, which is just amazing. Yeah. And yeah, the tickets don't really have a correlation to the input.
No.
So I get that. Yeah.
No, and the other unique thing that I forgot to mention too is just the way in which the legislature defined gambling device and defined it as broadly as it made sense, which encompasses amusement games as well. So that's another. So sometimes we'll talk about it as a gambling device, and it is because of the way in which it's defined, but it's not similar to, let's say, a tribal lottery system or something like that, in the way in which we're trying to regulate it within amusement games. And so really, things really started to kind of pick up, and I'll try and get through this a little bit quicker, pick up in January when the commission really started to engage in rulemaking. And so there was presentation to the commissioner, and then public, of course, had the comments. But right before the commission meeting in January, there was a second manufacturer and a third manufacturer that had put their games in and that were approved for the same sort of process. We literally played them, went, all right, this meets the basic definition, and with the way in which the rules worked, there was really no reason to stop it, because that's not how it was set up. Even though I know there was some concern of maybe trying to pause it, that's just not the way the rules were set up at that time. And in January, the numbers that we were able to glean were there were about 204 amusement games at about 80 locations, and no more than 8 at any location. January and February, it was consistently the commissioners and with staff presentation and lots of public input. And my understanding is the public input for these games were more than what we usually see, packed rooms, having to get rooms, so really valuing that public input. And addressing testing, because there were really no testing procedures, licensing of manufacturers, because in amusement games, basically somebody who was going to be a distributor could come in, bring their games if it looked good. We didn't have to really worry if somebody out of state or in state was the one actually manufacturing. So kind of importing some of that, talking about merchandise prizes, defining merchandise prizes, dealing with replays, just record keeping, so we could know a little bit more about kind of where things were at. ID stamps, which is already part of our fee structure, winning, wager limits, appearance, all things that were talked about in January and February, and really going forward. So in March, commissioners voted to pass a new set of Group 12 rules. The idea was to do them all at once, but just with some procedural peculiarities, we had to do it in kind of 2 stages. And so in April, there were in March for April 30th effective date, requiring manufacturer and distributors to be licensed. Testing and setting up a testing procedure that really wasn't there, $250 ID stamp based on a lot of actual stakeholder feedback, because it was a little bit lower, and actually some feedback said that maybe it should be higher. Wagering limit of, and this is what goes to Representative Condata, wagering limit of no more $5 with a winning limit of $1,000. And then shortly thereafter, the legislature had the budget in a special session. There was an allowance of a transfer of $1 million from the Lottery Unclaimed Prize Fund to the Gambling Commission, and we thank you very much for that, for our law enforcement purposes. But then there was also a direction to review and reconsider, including repeal, rules adopted to authorize amusement games classified as Group 12 and recognizing the impact that may have on state lottery revenues. And what I should have said also is, I think it was Commissioner Patterson, in either February or January wanted to put repeal on the table so that the commissioners had it as an opportunity. So we filed that so that the commissioners would have the ability in either April or May to consider that if they felt it was necessary. So at the April commission meeting, we also received lots of comments dealing with the repeal. House leadership on both sides sent a joint letter. Representative Hurst, you submitted your actually was oral comments at the commission meeting that you were at. Mayor Ed Murray also sent a letter showing concern about these and asking for repeal. The commissioners felt that there was a way to really put good sideboards around this and to bring it to where the commissioners thought it should be. So they voted to pass additional rules to continue to supplement what they had passed in March, dealing with replays of tokens and tickets, no cash prizes, really defining merchandise prizes as toys, novelties, food and beverage, retail items sold as normal part of a business that weren't gambling related, such as pull tabs, and it excluded gift cards and gift certificates as possible merchandise prizes. So really kind of restricted that and dealt with what was the cash problem. And those rules go into effect July 15th in order to try and deal with what we knew what was going to be coming, which was new equipment submission and having the 60 days for staff to be able to review it and to get it out. And then in May, the commission meeting, they voted to deny the repeal, instead moving forward with trying to really put the sideboards on the things that at least we were hearing from stakeholders that were going to be problematic. And the industry, you know, to their credit, was clear in the sense that of what they felt was going to hurt them. And the cash, there was some discussion about it, but really the replay was the thing that the industry really seemed to kind of come down on, that they felt that they needed, but that was not part of the rules. And then there were other things that were considered, which is moving forward, a warning talking about that this is not a slot machine, no cash prizes. They can even, and just a little bit more information, that either can be electronically displayed on the video screen or can be a sticker. It's up to each manufacturer, individual business, how they want to deal with it. At the May meeting as well, there was a written statement submitted by the licensees, which Chair, you referred to, dealing with modifications of games. But there was also, I think, it was one set, but there were 8 separate petitions looking to repeal all the rules that the commissioners had just put into place. And so also in May, best we can tell, there were about 385 games in Washington, not all of them in play. But we started to go out and started to try and be able to better track it in May. Testing and licensing requirements went into effect at the end of April, along with the winning and wager limits. So we started running some enforcement to try and make sure that those things were being followed and into play. Of the 3 manufacturers that had games in their state, only one submitted its games and application for licensing and testing by the deadline. And we put all of this on our website, and it's still on our website, as far as we started putting everyone on notice about non-compliance with the rules and started giving deadlines for compliance, or we would be facing possible civil and criminal penalties, including licensing action against their licenses and potential seizure and forfeiture of machines. And then shortly thereafter, those deadlines started to get close. There was a lawsuit that was filed against the Gambling Commission on May 26th. And so the lawsuit is the Amusement Device Operators of Washington, which comprises of about 10 individuals or businesses. They are challenging the rulemaking that specifically the commissioners put into place in March and April. They're challenging, I think, just about everything, but it appears, just based and gleaming on a brief that was filed, that the primary challenges seem to be the fees, the wager and winning limits, prohibition, sorry, there's a typo, my bad, prohibition of replays and gift cards, gift certificates as merchandise prizes, using kind of standard administrative appeal, which I'm just having been at the AG's office, very familiar with. And then there was a judge set. We requested a different judge, and so there was supposed to be a hearing on June 17th, but because of the change in judge, the they asked for a preliminary injunction, basically, hey, let's stay all these rules pending the outcome of the case. We are opposing that. And so there's a hearing on that preliminary injunction request at the end of July, on July 29th, which was a reset once the new judge came into place. And so that is kind of where we're at right now. Moving forward, we have a July 14th commission hearing. We're going to the commissioners are going to consider some additional rules to just try and deal with the warning label, which I showed you in the previous slide, additional reporting requirements, trying to clarify some things that we've accidentally kind of put into rules that may make things a little bit more difficult for the amusement industry. So we're just trying to clean up some things that'll be up for discussion next meeting and then for potential final passage in August.
Thank you, and I appreciate the work that you're doing and the positions you're taking. I think they're good positions. I'm going to reiterate what I said before, which is I think this is a bad group of folks that brought this into our state, and I think they had ill intent. Were not transparent about what their objectives were. I think their intent was to introduce slot machines, which is pretty much what they told their folks to go out and advertise them as. This is going to continue to be a battle. I want to thank the commission, the voting commission members on the change in the rules that they made, and I'm very hopeful that they'll stick to those. But on one final point, I'd like to say that the tone and tenor of the opposition to this has just been remarkable. Some of the bold statements that they've made and some of the statements that even a couple folks have called me up and told me of what they intended to do and how they intended to proceed are just remarkable. I've just never seen anything like it. And I spent 25 years in law enforcement dealing with a lot of crooks, a lot of bad guys. I worked organized crime cases. I worked narcotics. I was in a federal drug task force. And as I think back on my career, and the types of things that were said and how this group is proceeding, I do not think that they ever had good intent. I think their intent was to sneak under the radar and in a sneaky way get slot machines into Washington State. I think it's fine if you want to do battle and you want to lay that out and bring a proposal forward, good for them. And we would have hearings if someone brought a bill. If someone brought a bill in here during my tenure in the legislature to authorize slot machines, I would have granted it a hearing. If these folks had come in and brought their proposals, we would have looked at that. I don't know whether it would have passed or not. I think it would have been unlikely as a result of the position that the citizens have taken to say that we didn't want a massive expansion of gambling. So what I would like to see is that the Gambling Commission seriously consider aggressively enforcing violations of these rules on every occasion that it's possible to do that. And I don't care whether there's a pending injunction until such time as the court has said don't do that. I think that the way in which you deal with folks is you say this is the law, we will enforce the law until such time as a court tells us not to enforce that law, and that any delay in that would be an error. So that would be my suggestion. But I want to thank you for your good work. Representative Condado.
Thank you, Mr. Chair. Just a quick question. The revenue stream on these things, obviously the manufacturers have some money in it. See you, Steve. The people that operate them in their operations obviously make some money on them. Is there a tax revenue portion of this thing somewhere along the line? Are we making any money on these?
2%, I believe, isn't it?
2% of everything that flows through, or?
There's local taxes on amusement games.
Local, but not at the state level.
I do not believe so. No, sir.
Okay.
I can verify, but I do not believe so.
My understanding is it is local, much like a lot of what we do. The revenue stream that's coming into the state is really kind of meant to neutralize what the commission's spending, right? So that's why we have fees and licensing fees and stamps and things like that.
Pull tabs the same way?
Yeah, I mean, there's local taxes on pull tabs, and then there's the fees that they would have for licensing and stuff like that, correct?
Okay, thanks. Thanks for your work.
Thank you.
Thank you for your good work. Appreciate it very much. I'll see you on the 14th, I guess.
Yes.
Certainly.
Thank you.
And with that, we'll be adjourned.